Hello, everyone. I'm Sarah Wilkins. I'm the COO at Reverb. Very excited to have you here today to join us for the last session with Michaela and Jerry, and now the session with Dr. Turner and Kim Vu. In this session, we will be talking about creating healthy, inclusive cultures as we return to the office. I know this topic is top of mind for, people leaders and many of us in that space. And we hope that this session gives you some good ideas and practices you can take back to your organization and team. So as I mentioned, our speakers today are Dr. Shairi Turner and Kim Vu. Dr. Turner is the Chief Medical Officer at Crisis Text Line, a global tech nonprofit that has delivered over 5 million mental health conversations through texting. In her role, she handles Crisis Text Line's external mental health, race, and equity work. She's a Stanford graduate and a Harvard-trained internist and pediatrician with a Master of Public Health from the Harvard School of Public Health. Dr. Turner's experience also includes roles such as Chief Medical Director for the Florida Department of Juvenile Justice, where she was instrumental in the introduction of trauma-informed care, Deputy Secretary of Health and Interim State Surgeon General for the Florida Department of Health, where she led the reorganization for one of the largest state public health departments in the country, and a faculty consultant for the National Center for Trauma-Informed Care, where she performed national trainings on the neurobiology of trauma to state and local entities. She also currently holds a research faculty appointment at the Florida State University College of Social Work. Welcome, Dr. Turner. Thank you.
Thank you, Sarah, and hello, Kim, and hello, everyone. Thank you for joining us for what we hope will be a very engaging and exciting topic. So I'm going to
but I'll introduce Kim, and then I will no, that's great. Thank you. I'm glad to have you here today. And before we get into the presentation, I also wanted to introduce Kim Vu. Kim is the Global Head of Diversity, Equity, and Inclusion at Remitly, a fintech company serving over 5 million immigrants throughout the world to conveniently send money safely and securely to their families across global borders. And congratulations on going public today. I saw the news, so way to go. That's great for your team. She has been a banking executive and fintech startup advisor for over 20 years. The first half of Kim's career was spent building and growing new lines of business. The latter half has been dedicated to scaling the social impact of financial institutions, developing and leading corporate social responsibility and ESG strategies. Outside of work, Kim is a board member for Crisis Text Line on the Finance and Global Expansion Committees, and Kim is also an advisor to Included, a DEI tech startup helping companies surface data and insights to create more inclusive workplaces. Wow, you all have such great backgrounds and such great ideas and things that you're going to be sharing with us today. So thanks again. So I'm going to let you take over and start the presentation, and then I'll be back later for the Q&A portion.
All right, take two. Thank you, Sarah. Welcome, Kim. Welcome, everyone. We are excited to be here to have this, what we hope will be a really engaging discussion about where we are as a country in the setting of the pandemic, and how do we acknowledge that and help our staff and create inclusive environments for the people who matter the most, the people who work with us, the people who work for us. So let me share my screen very quickly. And okay, so hopefully everyone can see that. If not, Kim, maybe you can tell me, because I can't see anyone at this point. Okay, so
Looks good.
Good. Okay, great. So we're here, Kim and I are here to talk about creating healthy, inclusive cultures as we all return to the office. We're honored to just be asked by the People in Culture Summit Committee to have this very important conversation. So much of the data that we're going to be talking about today will be coming from Crisis Text Line, the organization where I work, and Kim is a member of the board. What's really special about this information and this data is that it can be very specific, and we were able to pull information and data from our texters that we felt would be very relevant to you all in your roles and relevant to this discussion. So, overview of what we're going to talk about: how does Crisis Text Line work? Who are we? An overview of our data, a look at some of our more specific pandemic data, a panel discussion with Kim and I, moderated by Sarah, and then questions. And this is just a note to say, please, if during the conversation you have any questions, please go ahead and utilize the Q&A section as opposed to the chat, so that we will have them all ready for that, that ending. So how does Crisis Text Line work? Well, we were established in 2013, and our vision is really about an empathetic world where no one feels alone. How do we empower that? How do we make that happen? Well, we as an organization provide free 24/7 high quality text-only based mental health support and crisis intervention and de-escalation. So anyone in the United States can text 741-741 or message us on Facebook or WhatsApp and be received by a volunteer crisis counselor. We handle about 3,500 conversations per day, and in total over the past 8 years have trained about 41,000 crisis counselors, with about 6,200 of them logging in to take conversations each month. So how does it work? Someone texts in crisis, and what we say is whatever crisis it is to a person is how we're going to treat it. There's no gatekeeping to what feels like a crisis. So if a person texts in 741-741 or sends a message on Facebook Messenger or WhatsApp, they will get an immediate automatic response to know that they've connected, and then asked to share a little bit more about their crisis. Shortly thereafter, the texter is connected with a live volunteer crisis counselor. These are people who have been trained. We have a 30-hour online training specifically for our crisis counselors. But what they do is they help the texter sort through their feelings. They ask questions. They create a space of empathy and active listening. The goal of every conversation is to get the texter to a calm, safe space so that they're de-escalated, and then at the end provide a referral for further help. Sometimes this means just being there and listening, where this person feels like no one else is available to me, but here's someone who's empathetic and can help with my situation. These volunteers are not on their own. Every conversation is overseen by a clinical staff supervisor, our crisis supervision team. They are mental health professionals who provide support to these crisis counselors by reviewing the conversations in the moment and helping them to determine what are some best steps, next steps, if they get if they're unsure. The volunteer crisis counselor always has the support of a mental health professional, our crisis supervision team. Less than 1% of the conversations, in less than 1% of the conversations, a supervisor might determine that the texter is in a life-threatening, imminent risk situation and needs support from emergency services. So at that point, the crisis supervisor steps in, takes over the conversation, and makes that connection with the local EMT, fire, police, or mobile crisis units. Again, this is a really small percentage of our conversations, our texter conversations, but an important part, because in every conversation we do a ladder up risk assessment to ensure that this person is not at imminent risk. And if they are, the crisis supervisor proceeds to an active rescue. Again, these 3 levels of support I discussed, the one piece I want to touch upon here is that we use machine learning and triage algorithm. And our machine learning algorithm allows that first message to identify texters at high risk of imminent harm. So for instance, if someone texts in and says, help, what is the nature of your crisis, is the response, and they come back with, I want to die. Our machine learning populates and pushes that texter up higher in the queue so that they receive attention faster, because we identified through the collection of our data what words indicate that a texter is at imminent risk, so that they receive support in about under 1 minute. If we look high level at our data, who are our texters? So we're the largest crisis texting service in the United States. We're everywhere because we're remote. Our volunteers come from all around the country. Our crisis supervisors are located all around the country. We're accessible to anyone who has a phone and can text in. Thus, we've had over 6.2 million conversations. We've served 2.9 million texters, all of this since our inception in 2013. We've done 84,000 suicidal de-escalations, so where someone really is seemingly at imminent risk of suicide, but are able to de-escalate and create a safety plan. Interestingly, 59% of our texters share something new that they have never shared with anyone else. They feel safe enough to disclose something that is that personal that they need help with. And at the end, we find that 87% of our texters find the conversation helpful. And this is what's beautiful about Crisis Text Line is this data is as of September. Because our data is collected continuously real time. There's no 1 year wait to aggregate and process. It's immediate data. Who are our texters? So what we see here is that the majority in 2020, the majority of our texters were female. Smaller percentages were male, trans, gender, queer, and agender. But I do want to point out that we collect this information so we know who we're serving. We don't just collect male versus female. We acknowledge the full panorama of genders. Then when you look at sexual orientation, we have the majority of our texters are straight, but we have a very large LGBTQ plus texter population. Again, it's important to ask these questions so we know specifically who we're serving. This also allows us to say that this is the data on LGBTQ, and we can call that out specifically when needed. Texter demographics, predominantly white, but we over-index for BIPOC communities. So Hispanic second, Black, Asian, American Indian, Alaska Native, Middle Eastern, Native Hawaiian. So as you can see, again, it's very important to us that we disaggregate, that we get as specific as possible when we ask our texters what their demographics are, so we know who we're serving, so that we know our volunteers are prepared and know that they're serving a lot of people, many of whom are otherwise do not have access to mental health services or crisis de-escalation services. When we look at the age of our texters, look how many are 13 or younger. That's almost 20%. The largest population, as you can imagine, who's out there texting all the time are those, early adolescent, mid-teens, and then as the texters get older, there's slightly more of a decrease. But this tells us two things. One, we've got a lot of teenage texters, and two, a lot of our teens in this country are in crisis. So when we look specifically for the purposes of this conversation, you all as HR professionals are probably working with parents. And so we wanted to look at what are parent age texters concerned about coming out of this time at home and returning to the workplace. So parental mental health based on Crisis Text Line data in 2020. Interestingly, we did not have a specific tag for parents. So in this work, we've pulled data for people who are parent age, the age of being a parent, so 25 to 44. in pulling the presentation together, I made note and passed on to our data scientists. We really should be capturing who's a parent. Like when we have the post conversation survey, we need a place to say, for the texters to say, I am a parent. So we again know who we're dealing with and how we best serve them. But if we look at the parents who might be your staff dealing with children going back to school, with just going back to work themselves, the whole hybrid virtual environment, what's bringing up, what are this population, this age group of texters, what are they concerned about, what do they care about between 2019 and 2020? And then, so what we're looking at here, the light pink are all texters, and the darker red are parent age texters, 25 to 44. Clearly, anxiety is something that everyone is experiencing, but look at those texters who are 25 to 44. Anxiety is very high in that group, almost 45%. What's next? They are concerned about their finances. They are dealing with grief, and they are dealing with substance abuse. So you can see, of all of our texters this year, in 2020, these are the issues that are most impactful to the parents who are potentially in your staff. So as we move forward in this presentation, we've geared it to look at what can we do, knowing this, to support parents, and to provide suggestions and opportunities for you all to look at within your organizations, to provide support to these parents who are working and helping their children at the same time. So with this, we're going to go, I'm excited to join Kim Vu, and we're going to have a little question and answer panel discussion between ourselves, and then open it up to the audience for you all to ask us questions.
Thank you, Dr. Turner, for sharing that presentation and all the data. I'd love to follow up, as you mentioned, and with a few questions, starting with you, Kim. Based on the data, parents and parent-aged adults are continuing to feel the impact of long-term complex home and work dynamics due to the pandemic. It's kind of a two-part question. What are some of the ways that companies can support parents and families, and also what emerging trends have you seen begin to surface?
Sure. Thanks so much, Dr. Turner, for sharing all that information, kind of laying the groundwork for our discussion today. And Sarah, I think I'll start out with kind of the first part of that question that's really around how can we continue to support families, and also just our multi-generational employee base at many of our companies. I think a lot of things that I think are very simple to revisit and check in about. Obviously, right now is a time of year where many families with school-age kids are going back or have started going back to school in person, and really making sure that we're spending time with our people managers, with our employees, to encourage them to take that time off. Right? Take the time to get them reacclimated back into their new or renewed daily routines. Because for many of our employees and our workers, they're still working remote, they're still working distributed. Some of them may be coming back into the office, but many of them have to rediscover these new routines that they've been, off, have been off on for the last year and a half. And so just being able to even just reach out and remind our people managers to say, hey, this is a good time to tell your employees, if you've got kids, take the time to check in with them, make sure that, if they're coming back at the end of the school day, take a couple hours off and spend a little bit of time checking with them, see how they're doing, how they're acclimating back into school life, and checking back in with yourself too, in terms of how you are getting back into the routine of things as well. I think the other thing from an employer perspective is really going back and refreshing and revisiting all of our flex schedules, shared jobs, and extended leave benefits. I think many of us in the course of this last year, rushed to make sure that new policies were in place, but with the intent that it was going to be temporary or short term. But what we're finding is that this is becoming a much more prolonged, sustained way of work. And so as we start to think about that, is how do we need to go back and revisit some of those policies that create the flexibility for not only families and caregivers, but also other individual experiences that are kind of happening in this new hybrid world. And then I think the other piece too is, we saw a lot and heard a lot from our own employees, even at Remitly, about how much they appreciated every leadership saying, hey, like, take the time off. We're gonna institute 3 or 4 day weekends once a month through the pandemic. And again, prolonged, sustained. A lot of our employees came back and said, hey, like, it really helps when we know we can take a day off collectively together, so that I'm not stressed out about whether or not I take the day off, but the rest of the team is still working. So therefore, I feel like I can't take that day off, or if I take the day off, all I'm thinking about is what I need to catch up on when I get back. And so thinking about how do we institute some of these temporary practices that we put in place over this last year, and really think about the possibilities for what it looks like for ongoing benefits that really kind of support our employees. In terms of trends, like the data that Dr. Turner shared around some of the things that our 25 to 44-year-old employees may be experiencing. One of them that came up was this focus on finances and the stress that they're experiencing. Many of our employees are experiencing that for a variety of reasons, right? Some of it could be because they may have had a partner or spouse or a family member that potentially could have lost a job during the course of this last year, or perhaps they themselves as a family decided that one parent would step out of the workforce due to kind of the shift in the way that the household was operating over the course of this last year. And so financial strain became a big concern for a lot of individuals. And so what I've been seeing, and that we've been seeing, is that there's a lot of new services that are starting to come online to really support employers to help their employees, like companies like Origin, that's providing financial services through employers for their employees for investment planning, for budgeting, or companies like BrightUp that are providing low-cost loans and financial education for employees who are really trying to pay down their debt, or have accrued, healthcare debt potentially, right, from things that may have occurred over this last year. And then I think that some of the other things that have really started to see trends in terms of support is many of our people managers are tired, right? They're really exhausted and they need additional support and training as well, right? They're managing not only their own mental health, but the mental health of their teams. And many of them are unequipped to really kind of navigate this new space, right? As mental health becomes more common and more safe to be able to talk about in the workplace. So how do we make sure we equip our managers with the ability to really understand how to have those conversations with their employees, but also how to, if they are in a situation with an employee and need to de-escalate this situation in order to be able to hand it over to a medical professional, be able to provide and support. So being able to work with organizations like Modern Health or Mental Health First Aid to really certify and provide that potential support for your people managers. And then I think finally, the last thing around trending is, because we are in this distributed environment, and because we are moving much more towards this remote, distributed, hybrid environment, is how are we thinking about inclusion and belonging in these environments where there's so many different things that we have to take into consideration, right? And so one of the things that we've instituted at Remitly was what we call our thinking environment meeting norms. And so, and what those meeting norms are is essentially, a meeting isn't complete until every person has an opportunity to speak, right? And so really kind of thinking about where folks are, whether they're in the office or they're in their home or they're somewhere else that or in different time zones, that they really are intentional about making sure that everyone has the opportunity to be able to contribute in a thoughtful way.
Wow, thank you, Kim. I jotted down so many great ideas that I hope our participants can take away as well. The shared days off. I know at Reverb we've done that, and it's been such a nice thing to have. And then all those resources for supporting employees and managers are great as well. And so kind of on that, continued support and benefits and resources. Dr. Turner, I know Crisis Text Line works with many organizations, including nonprofits, companies, government, schools. What are benefits or programs that you've seen in the past year that are particularly unique and stand out? And I know, Crisis Text Line has a lot of their own as well. So.
Yes. So we had the opportunity, thank you, Sarah. We had the opportunity to really revamp in the past year our entire benefit system based on what was out there and available, and also based on a survey that we did of our staff. We wanted to know what do staff need? What is missing from your benefits package? What would make your life as a parent at home better? What can we provide? So our philosophy was really that we wanted to create a package that reflected also our commitment to an inclusive work environment, and inclusivity went across the board: race, ethnicity, gender, ability, disability. And having that survey gave us the opportunity to know what we were shopping for that would best serve our staff. So first and foremost, we looked at a comprehensive benefits package. So dental, vision, life, health savings, flexible spending plans, which many people do, but we were really intentional about what the offerings were. We did 403B plans that have a 3% crisis text line contribution, regardless of the employee contribution, right? So if staff are on a limited budget and they can't put into that contribution, then an allocation, then they wouldn't get an employee contribution. So for us, if a staff person puts in 0, crisis text line is still putting in that 3%. We looked at our holidays. As Kim talked about, we expanded the number of holidays, we made them flexible, vacation, personal sick days, and really let the employee define for themselves. We have volunteer sabbaticals, which is 4 weeks paid if an employee volunteers for another organization, student loan repayment, and then we looked at allocations. So again, going back to that bar chart, anxiety, finances, these are things that are stressing people out. So we did a monthly allocation for mental health services, a separate monthly allocation for wellness benefits. So people need to get exercise. They can choose multiple choices, whether it's virtual or in person. They can go and have a stipend towards that. And then also for professional development. So we now see so many virtual professional development opportunities. We created a whole learning and development program for our staff that was stacked upon these learning and development opportunities. Keeping in mind people's finances, we worked with Benepass, which is a benefits card where staff can draw from that for all of these, draw from that to access these allocations, these stipends. So for someone, you can have a full menu of opportunities and offerings, but if you ask staff to, again, reach into their pocket, understanding there's a reimbursement period. And for people who are on a budget, they're not able, it's not equitable. They can't access these services because they can't put out the money up front. So with Benepass, it's like their allocation is on a credit card and they can utilize it immediately and it's paid and there's no worry about the reimbursement times. We set aside a $500 home office stipend that would allow people to utilize whatever they needed to set up an office at home that worked for them. And then some of the interesting other things were virtual childhood enrichment throughout school. So how do we help parents who have kids at home that need some interactive attention? We've partnered with OutSchool. And then we also found interesting, there were some other things that we're looking at this year, legal support for for parents, like something that will offer them the opportunity to tap into some legal advising and also financial advising. So those are some things that, as we look at our package at the 1 year mark, again, assessing with agility what people need and trying to meet those needs. And we too had the 2 restorative days that we tacked on to existing 3-day holiday. One was tacked on to a 3-day holiday, but it's true just to know that the rest of the organization isn't busy at work, but that everybody's taking downtime is actually more restorative than we had thought.
Wow. Thank you for sharing all those, Dr. Turner. Such a comprehensive and holistic view of an individual and all the different ways in which you could support them. So those are some great ideas. Thank you for sharing. Kim, another question for you. As you look back on the last 18 to 20 months, what do you think are some of the lessons tech has learned over the past year, and how has it changed our companies and cultures as we look ahead?
I think there's a lot of lessons that we learned this last year, and we're still in it, right? So we're still learning as we go. So I think there's even more lessons learned. So we can definitely take this question like next year and probably have even more that we've learned. But I think probably of all the things that I think that stick out to me the most over the course of the last 18, 20 months is really, truly the humanization of the workplace, and how empathy has become such a huge centerpiece of what culture means for so many organizations. I think a lot of organizations this last year really had their cultures challenged by the instances of all of the things that happened over the course of this last year, whether it was the pandemic or whether it was what was happening within our communities of color, especially our Black communities over the last summer, and to our Asian community members as well, as the rise of Asian hate occurred as a result of COVID, right? So, and that's just a few of the things, right? Lots of different things happened over the course of this last year. And so what, as HR professionals, well, of course, the humanization of the workplace is something that you'd be like, well, yeah, sure, that makes a lot of sense. But I think it was something that it became a reckoning for a lot of companies to really look at their culture and say, can our cultures withstand this? And what is really needed in order to really help companies pave through what we've gone through and what we're currently still going through, is this core centerpiece around how do we have this recognition of everyone's unique lived experiences and identities, and really centering that, and also being able to show our ability to be adaptable as an organization, and be flexible to the needs of our employees and meet them where they're at. I think the other thing that I see as kind of the trends that we saw, and I think, going back to Dr. Turner's data that she shared, is about texters as kind of like a good example, is how important demographic data is to help inform us, not only as HR professionals, but as business leaders across the organization, so that we can be able to deliver on meaningful employee support and benefits across the organization. And then I think the third thing that has been coming out too, and again, goes back to being tied to data as well, is just really starting to connect with meeting the expectations of all of our various stakeholders within our organizations, right? And being able to bring them along in that process. And we're starting to see a lot more of that coming from the market, from investors, from the community, from other business leaders, from our employees and our customers. And so really getting a finger on understanding and getting a pulse on understanding who our stakeholders are and what those needs are, and really starting to pull together both the qualitative and the quantitative data to really be able to support our employees around that.
Thank you for sharing those. Yeah, I'm sure next year we can revisit this conversation and find out more. Final question for you, Dr. Turner, before we go to Q&A for the audience. You shared early on in your presentation about how Crisis Text Line provides mental health services via text. Does Crisis Text Line support or partner with companies or other community organizations? And what are some examples of current partnerships?
Yes. So we engage in really intentional partnerships, focusing both on outreach. So how do we get the message of Crisis Text Line and our services out to the world, out to the country and the people who need it? And then also partnerships to help recruit volunteers. We are always looking for empathetic individuals who want, from any walk of life, who want to train to be able to help and serve other people from the comfort of their own home. So our partnerships are varied and assorted. We have keyword partnerships, which means that if someone wants to advertise, let's say if it's North Dakota, if they want to advertise Dakota in all of the messaging around their state, they are able to, we put up something that says text Dakota to 741-741, and then that state is able to, we're able to pull that data specifically for them. And that goes for state and local governments, that goes for small and large organizations. Anyone can come up with a keyword partnership so that they can see specifically where and who they're serving and better allocate sometimes often very limited resources. Some other notable nonprofit partnerships that we have: the American Foundation for Suicide Prevention, Blue Star Families, Child Mind Institute, Mental Health America, National Association of Mental Illness, We Are Native, that serves our indigenous peoples. But in total, in addition to this, we have 39 state and local government partnerships. So through this, we both get the word out for what we're doing. Most recently, I do want to plug two things. One, we now have a fully bilingual service, which is going to launch in a few weeks, so that we're able to fully launch in a few weeks, so that we're able to serve bilingual texters, and not just bilingual like translational, but bicultural as well, because we have Latinx supervisors and coaches who are there to support not just the language, but the community itself. We have school mental health toolkits, which are available on our website, so that parents, teachers, administrators have actual tools that they can use to support the students in their school districts and in their schools. And then we have a really wonderful School of Social Work practicum. So we were able to support during the pandemic and now beyond schools of social work who need to have a practicum available for their students to graduate. And those students become volunteers and are supervised by our licensed mental health professionals. So it's a win-win, because they learn and they're our volunteers, and we're able to help them complete their MSW degree. And my last big partnership that we have is Nike. They are so much about supporting the mental wellness and well-being in general of athletes and their staff. So we have a really great partnership with them to support both their staff who can volunteer and their staff who may need our services, and then just getting the message out through so many accomplished and humble and vulnerable athletes who are willing, as we see, to share their stories.
Wow, thank you for sharing. I love the examples of partnerships and the keyword, and the example of how Nike's been able to do it from a corporate standpoint. We do have one question at least now, and if you have other questions, please put them into the Q&A tab, and I'll ask. So this is for both of you, so I'll let you decide who goes first. But what sort of positive change in the workplace are you anticipating or hoping for as a result of the pandemic?
Shairi, Dr. Turner, do you want to go first?
You want to start? Okay, that's a great question, right? So what's the silver lining in all of this? And I think that's an important question to ask, because it's an important thing to continue to highlight, right? We can very easily focus on what's been hard, what's been bad, what's been negative. But if we can flip that around and focus on what's been positive. So things in the workplace, so many places have now explored the innovative ways to be virtual, right? To offer those options to staff. Kids now can, the school, right? Where schools were not virtual in any way, even if they've gone back now, they know they have the capacity to support a virtual learning environment. I'm hoping we continue with those innovations, right? So like all of the platforms that have now come forward to help support us, like here, where we're able to access conferences and meetings. And when you think about for parents, those evening meetings where you'd have to like pack up and leave and go somewhere to school, or to be able to like tune into your meeting and cook your dinner at the same time is a thing. It's a real opportunity. So I continue to look forward to the innovations that have developed that support the people who are working, who are parents, who are just trying to exist in this new normal.
I think I would add to that as well in terms of like the new innovations, in terms of what we've seen with like telehealth and telemental health, right? Making it far more accessible for a lot more people. But as we think about the workplace specifically, I think two things that are potentially bright spots in terms of just, I think, organizational learning. One is around removing I'm losing my words. I'm off on like East Coast time, so my brain is off. The stigma. Got it. The stigma of mental health. One, of being able to just talk about it in general, but two, specifically to talk about it at work, right? To have the ability to be able to bring it up in conversations at work, to be able to have a discussion, more openly about mental health and taking care of mental health, and then providing the resources to be able to access mental health services, I think has been huge, right? I think it's really helped the general movement towards a more healthy culture where we're talking more openly about mental health. And then I think the second too is because we had to go into a virtual work environment, I think it really opened everybody's perspectives on understanding the different ways that people think and operate and process and present in the ways that they work, right? I think a lot of times, if you remember early on, this feels a long time ago, right? But early 2020, there were a lot of different lived experience stories of individuals who have invisible disabilities who said, hey, I asked for these things a long time ago, and now all of a sudden, because the entire workforce needs it, now the accommodations are available. So I think it just made it really visible to everybody of, hey, these things are possible. We can shift and change our workplaces to make it more inclusive for everyone. And it's just a matter of that will to get there. And I think we've learned a lot in that process of really being able to think about how can we create more inclusive workspaces, not just physical workspaces, but spaces that work for everyone in the different ways that they process and present and think and operate.
Yeah, thank you both. Those are great. Another question came in asking for, any tips for navigating the gap between employee interest in returning to the office and senior leader preference, which, can create anxiety when the expectations differ.
Yeah. Sure. Yeah. Yeah, I can jump into this one. Okay. So there can be gaps, right? There's gaps in the way that what employees have experienced now, being able to balance and navigate and move in and out through their personal and work lives in a way that has been able to give, in many regards, give them time back, right? To be able to manage different things much differently than having to like commute back and forth in the office place. But then you also think about, there's also many lived experiences for many communities of color and multi-gender experiences in the workplace where actually being at home is far more psychologically safe, right, than having to come into work. And so I think those are the things that senior leaders have to take into account of saying, if we really want to be able to create a more inclusive workplace and a more inclusive culture, then we need to take those things into account. And also to be able to say, okay, like, here are the ways in which we agree upon that it's necessary for us to be able to have spaces to come in, to collaborate together, to meet, to connect, to have retreats, to be able to strategize together. And then here are the tactical, task-oriented, day-to-day things that actually don't require us to physically be in a space, where we can say, okay, like those are the places in which we can bounce those things out, and really giving in the space and empowering our employees to be able to make decisions for themselves that really continue to help not only keep the business moving forward, but makes the employees much happier and improve our retention.
And I would only add one other thing, a couple of other things to that. We are about collecting data, and not just on our texters and the conversations, but also from staff. We want to hear from staff through surveys. So I think it's important, like Kim said, that you understand the intent of what you're trying to accomplish by bringing people back to work versus, and then hearing from staff, what is the impact with that? Could I be more productive at home, actually? And how do we accommodate that in some more innovative ways? So I think it's super important to know what you're trying to correct, right, by bringing everybody back, and what's the intent there, and how can you find that middle ground for those who actually are doing better and are more productive for your company by staying virtual.
Thank you. We have about 1 minute left, and one question did come in, so I'll go ahead and ask. So if anyone can stick around and listen, that would be great. So the question was, what recommendations for training do you have for HR managers to properly assist employees with disabilities?
Kim, I will give that to you.
Sure, happy to try to answer that one. So, in quickly as possible, I think one of the things that have been really helpful for us is working really closely with our two different kind of key stakeholders around that. One is working with our HR healthcare providers to be able to, and brokers, to be able to identify what resources are available to us to be able to, one, not just educate our teams and our managers, but also educate our employees in the process as well, in terms of really understanding what is possible for us and really understanding like those needs. And then the other piece that has actually been super helpful for us through the process is we actually went through refreshing some of our policies over this last year or so, and reviewing and looking at our anti-discrimination policy, and really kind of revising and looking at it with our council to say, what is the new kind of parameters around understanding how do we support employees with disabilities, like, and really understanding like what is that scope, because it's actually expanded. It's much more broad and inclusive. And so I think just educating ourselves from that perspective, and then working with our healthcare brokers and providers, and really understanding what resources they have available to us that we can then share with our employees through that process. But those have been our two key partners for us that have been really helpful in helping support our HR teams.
Thanks. Oh, go ahead.
Sarah, I'd like to make one plug before we end. For you all as HR professionals, put your mask on first. You are the people carrying the people. Don't underestimate the stress of that, and make sure that you have your support systems available, and that you know that crisis text line is available for yourself as well as your staff, and all of these other resources. Please, the organization, you are so pivotal to every organization, the work that you do, but you cannot operate from an empty cup. So please make sure that you identify for yourselves what refreshes, rebuilds, and rejuvenates you.
Thank you, Dr. Turner. Yes, that's so important, and thank you for calling that out. We are at time, and I'm sure we could keep talking forever and have lots of questions, but thank you both so much for the data you shared and the answers you provided. I know there's a lot of great practical and ideas that people can take back to their organizations. So yeah, we thank you both once again. So yeah, we're at a break right now, so you can join the networking or the expo, or grab a cup of coffee or water or whatever you'd like. And then the next session starts on the main stage at 11:15.
Thanks everyone.
Thank you.
Bye.
Bye.
Bye.